Welcome once again, friend. Today we are going to discuss in continuation part of the most commonly repeated one-liners in ENT. This is the fourth part in the series. So coming up with the first question. So first question says the which cranial nerve that passes through the internal auditory meatus. So the seventh cranial nerve that passes through the internal auditory meatus. The second question is otoconia. Otoconias are seen in utricle of the inner ear. Otoconia are seen in utricle of the inner ear. The most important question which is repeatedly asked, this is very important, it is repeatedly asked, that is stria vascularis is present in cochlea. Stria vascularis is present in cochlea. Fourth question which says the referred pain, which said about the referred pain. The referred pain to the ear occurs from many structures. In this question, it is asked that the pain of tonsillitis, pain in case of tonsillitis is referred to ear is through which nerve? That is the ninth cranial nerve. Okay. The pain in tonsillitis is referred to ear through ninth cranial nerve. This is also very important question which is repeatedly asked in NEETPG exams. Next, the fifth question says cauda tympani. Cauda tympani passes between which layers of tympanic membrane? So, cauda tympani passes between the middle and the inner layer of the tympanic membrane. Going to the sixth question. Sixth question says pinna is made up of how many cartilages? So, pinna is made up of only one cartilage. So, we have to keep in mind that pinna is made up of only one cartilage. Okay. Now, we are going to discuss the seventh question, which says that complete absence of bony and membranous labyrinth is seen in which type of ear deformity, that it is known as Michael aplasia. We have to keep in mind, this is very important question. Michael aplasia, there is complete absence of bony and membranous labyrinth. So this is complete absence of inner ear structure, or we can say complete absence of inner ear structures. Okay, this happens when there is a failure of development of otic placoid at or before the third week of gestation. Otic placoids are not developed or fail to develop at or before the third week of gestation. So, the three questions are there. Out of one question, one is that which structures are absent in Michael aplasia. So, we can say bony and membranous labyrinth is completely absent, or we can also say inner ear structures are absent, and this occur due to failure of development of otic placoid before or at the third week of gestation. Membranous labyrinth. The eighth question says membranous labyrinth developed from surface ectoderm. We have to keep this in mind. Membranous labyrinth developed from surface ectoderm. Ninth question, this most important question of NEETPG, almost repeated after 1 year, that is the direction of bony external auditory canal is. It is downwards, forward and medially. We have to keep in mind This is downward, forward and medially. Last question that is for the today's series is question number 10, which says the joint between malleus, one bone is malleus, the second bone is incus. So the joint between malleus and incus is our saddle joint. So we have to keep in mind the joint between malleus and incus is saddle joint. So this completed with the fourth part. Stay tuned. The fifth part is on the row. Kindly, if you like my video, like, share and subscribe. Thank you.